Once you have ligament, when you pinch, it's gonna be a fold there. So this one is cyclic ligament. This one, origin of zygomaticus major. So how to inject? The first way, you can inject with the sharp needle. When you palpate that one, you can mark. But anyway, you have to clean the skin before. Do not inject at the mark. You can pull the skin up to lift the face up by injecting in this way. And then you put the needle there, touch the bone, aspirate before to make sure that no blood coming into the syringe. And then you can inject 0.1, 0.2, or 0.3, depends on the patient face or the severity of sagging and the severity of the bone loss. The other way is inject with this cyclic ligament. The other way is inject with the cannula. This upper border and lower border of zygomatic border, zygomatic arch. And this is cyclic ligament. Clean the skin, needle in, circular movement, and then filler with the cannula. Go deep, then go deep, touch the bone beneath the mass, touch the bone on that way, and then inject. For the sharp needle, inject in this area is more precise compared to the blunt cannula. You can inject both us. This one is the first point. Second point here, ZCL, zygomatical cutaneous ligament. How to inject this one? ZCL, zygomatical cutaneous ligament. You can inject with, again, okay. You can inject with you can inject with the sharp needle, but you have to touch the bone, aspirate before, and make sure no blood come into the syringe, and then inject. But I recommend injecting in this way with the cannula. How to inject? Pinch the skin, clean, and then needle in, circular movement, and then filler. Come with blunt cannula. Go deep, not superficial, as I mentioned before. Because you have to go deep, you have to support the structure, and you go deep in a deep plane. And then you can inject in fanning technique in a deep plane to support the structure in deep fat layer. And then you can create the structure and the support to lift the face up. In this area, you can lift the face, you can lift nasolabial fold, and also you can treat under the eye in this area. And then the third point, the third point here. Here is what's the name of ligament? Do you remember? Do you remember? This one. Parotid cutaneous ligament. No name here. Here, different from the two area. Here you cannot go deep. Why? Because there are some important structure there, such as parotid gland. You cannot go deep beneath the mass. And there are also the muscle, masseter muscle, the nerve, facial nerve, and the vessel. So you should not go deep. You cannot. So in this area, you inject in subcutaneous. How to inject? Needle in, clean skin first, pinch, needle in, and then filler come with cannula. And then you go in subcutaneous plane, inject in fanning technique by using non-dominant hand to assist the technique of to assist the injection, and then to facilitate the injection to make it easier to inject in this plane, inject in subcutaneous pain, and you can feel the crick crack sound of periodic cutaneous ligament. Next is here. Here is, what is the name of ligament here? Do you remember? P. Start with P. Platysma auricular ligament. Good. Platysma auricular ligament. And this is a fourth ligament. Here, again, normally you can inject in deep plane, touch the bone, but most of the time I inject in superficial plane. Here, once you inject in this area, the needle in and the cannula, and then you have to pass through the first ligament in this area first, lower mesenteric ligament, if you remember that I mentioned in the beginning, and then platysma auricular ligament. You inject in linear and fanning at the angle of the jaw, and then here is the area of my own technique. I call this one is deep subpsychoma plane. Actually, this one is the area of, I'm going to show you, the conjunction of the three ligaments here. First one is zygomatic ligament. This one is zygomatico-cutaneous ligament, and here is mesenteric ligament, which is here. So it's the area of the Y pattern of three ligaments. And here somebody in the old textbook call it McGregor patch. And once you inject here, I'm going to show you how to inject. Be careful again. Here you have to pass through the buccal branch of facial nerve. So you have to inject in this area gently. Actually, all the areas you have to inject gently. And here also there is facial vein here, facial vein there. So be careful also. How to inject? I make the puncture here normally around the jaw area, and then it will go up. This is my own technique. Nobody do something like this. And go up in the deep plane. Go up, but in a deep plane. So I'm gonna go in the deep medial cheek fat and touch the bone, and you can feel the tip of the cannula touch the lower part of zygomatic bone, and then inject. This of that time I'm teaching my trainee. So I touch the bone already, and then I started injecting in this area to support. You can see the Y pattern: zygomatic ligament, zygomatico-cutaneous ligament, and mesenteric ligament. So it means that if you inject in this area, you can have the effect for all three ligaments: zygomatic, zygomatico-cutaneous, mesenteric, to lift the face up, and also you can support the volume loss on that area also. And then the next point is here. What is this ligament? Do you remember? B. Start with B. Buccal maxillary ligament, the upper part. As I mentioned before, if you remember, this is buccal maxillary ligament. The one that why you have nasolabial fold because of this ligament. The upper part is a true ligament. Lower part is a false ligament because lower part there is no bone support. But the upper part, this is conile fossa. There's bone there. So the upper part is true, lower part is false. in this topic, I'm gonna talk about only the deep, in the upper part of buccal maxillary. So if you want to go there in the deep plane, you have to use the sharp needle. Here, this is buccal maxillary ligament. The upper part is true, the lower part is false ligament. With the sharp needle there, but what structure you have to be careful in this area? Do you know? What is that structure? Facial artery. Good. Here, normally there are a few variations of facial artery here. Some have facial artery here. Some have facial artery here. In buccal, some have on nasolabial fold or buccal maxillary. Some have the facial artery along zygomatical cutaneous ligament, just in front of facial vein. But in Thailand, as cardiac workshop, we noticed that 51% of cardiac have both at the same time. So it means that about half of Asians have double facial artery. So you have to pay more attention on this area. Once you have ligament, once you notice where the ligaments are, they always come together with the vessel. Once you are going to handle with the ligament, it means that you are in danger, because those are the area of main vessel. So here, when you want to inject here, do you know which layer facial artery located in which layer? Do you know? Facial artery in subcutaneous, right? In subcutaneous. So if you want to inject with the sharp needle, you have to inject through this layer, touch the bone. That is cheaper, safer. And then you have to aspirate and then inject. But if you want to inject along nasolabial fold with the blunt cannula, you have to inject in subcutaneous pain. But you have to be careful because the facial run on this area, in this layer. But as I mentioned before, once you want to support the structure, you create the lifting. But for superficial pain in this area, you're gonna treat the fold in different. This facial artery, you see. So with the sharp needle, you go through, pass through this layer, touch the bone, aspirate before, aspirate, and you can see the bubble come into the syringe, no blood, and then you inject. You can inject. The next point, almost done. Here, mandibular cutaneous ligament or mandibular retaining ligament. Here, I'm gonna show you. Needle in, normally on the area of jaw, behind the ligament, and you insert the filler cup with the cannula in subcutaneous plane. Anyway, you can inject in deep plane, touch the bone there with the sharp needle, but normally I inject with the cannula in linear fashion, in subcutaneous. I support. We call here is pre-jaw sulcus, and also the tip of the chin, base of the tip of the chin. In this area represents mandibular cutaneous ligament. And if you go from here to here also, you can create elongate chin also. The next thing here, Here's, I call it extension of mandibular cutaneous ligament into labio-mental crease. If you inject filler here, you can treat the jaw because you unfold the skin as I mentioned before, and also you can treat this crease, labio-mental crease, which will be more visible over the tongue. Here, how to inject. Needling, circular movement, and then filler come with the cannula. Again, I inject here in subcutaneous plane, fanning technique. Treat both the area of the upper part of pre-jaw sulcus and also labio-mental crease. And I noticed that if I inject this in this way on this area in subcutaneous plane, you can lift the mouth corner up and you can treat jaw too. Okay. Then I'm gonna show you the picture. This is before and after total facelift with the filler. You can see the lifting effect. No toxin here. You can see her eye look more energized. Lift the eye, look more fresh, and the face look lifting. Her mouth corner turn up. Her face after treatment look happier, younger, and less sad. If you notice before and after, once you inject the filler, not only make the patient look younger or more beautiful, but you can treat negative emotion on the patient face. Some patient look sad, some patient look angry, some patient look tired. So once you treat, you can achieve all purposes of the treatment. Before and after, look. She isn't smiling. This is a relaxed position compared before and after. This is a case that I present at the beginning slide, at the early slide. This is before. And after the treatment for the whole face, the patient looked a lot younger compared to before, more than 10 years younger. You can see the huge difference after the treatment with the filler for the facelift. Before and after. And as my experience, I can see many cases, the patient look not only younger, but we can prevent the problem of the fat in the future for the patients also. If he wouldn't do the filler injection on this day, 10 years later, he gonna have more problem or more severity of the sagging and many problem on the face. But if you treat him as soon as possible or as early as you can prevent the problem in the future for them. You can see the face lifting. He look a lot younger, more handsome, and look the jawline and the contouring of the face. Is another case. She is almost 50 years old, about 48. She has a big eye bags and the skin sagging. You see, not only the cheek, you can see the submental fat represent the skin sagginess. And after the treatment, she look a lot younger. I think more than 10 years younger, look more beautiful. That is the effect of the filler, the injection technique, and all of them, it depends on your design. When you assess the patient, you have to decide what to inject, where to inject, and how to inject, and you can achieve the best result of the treatment. So you can follow my page if you want to. Okay, thank you very much. Do you have any problem? Thank you. You can ask any question from the floor. Any questions? No question? Okay, thank you very much.